Miss Sidratil? Good morning, sister. Good morning. Please have a seat. Thank you, sister. Did you have your breakfast? Yes, sister. So today I'm going to take your activity of 12 cranial nerves. Yes, sister. Hello everyone. Myself Miss Mohita Kaushal, studying in Sarji Institute of Nursing Sciences. Today we're going to demonstrate how to check or how to test the 12 cranial nerves. Before starting the procedure, let me explain the articles we needed for test. First, we have the material to check the taste, material to check the smell, then a pen torch to test the vision, a tuning fork to test the hearing, a tongue depressor for the gag reflex, then we have a gauze piece, lastly a sternal chart to check the vision. So let us start with the procedure. First we are going to check the olfactory nerve. First test, we have to assist the patient to sit down, then ask the patient to clean their nose. If the patient is having any cold, cough or anything, especially we have to tell the patient to clean their nose. So first, ma'am, please close your eyes. Then ask the patient to close their one nostril. Then take your material for smell to check the smell. Now you can put in front of the one nostril. Then ask the patient to breathe. Ma'am, please breathe. It is powder. So when the patient guesses correctly, their olfactory nerve is working or active. So this is the first. Next we are going to check for optic nerve. For evaluate the optic nerve, we have three tests. So first start with the controversial visual field test. For this, ask the patient to stand. Ma'am, please stand up. Then keep the distance of one arm. Then ask the patient to close their one eye. Then opposite of yours. Then tell the patient to look into your eyes. Ma'am, please look into my eyes. Yes, sister. So now I will show you. You have to focus in my eyes. You should not look in my fingers. Yes, okay? Look into my eyes. How much is this? 1. This? 1. This? 5. This? 5. Okay, good. Next. Again, leave the hand. Again for opposite eye, same. Ask the patient to look into your eyes. 1. Ma'am, how much is this? 5. 5. 5. 1. 2. Okay, good. So now she has said everything correct. The first test is finished. Now second, that is called acuity vision test. For that we are going to use this Snellen chart. Keep the distance of 20 feet from the patient. Ask the patient to close their one eye. Ma'am, please. Can you please read the 8 number line? Yes, sister. D E F P O T E C. Now for the set. Now the second. D E F P O T E C. Now from both eyes and speak. Here. D E F P O T E C. Good. So if they are able to see and read, their optic nerve is correct. So the second step, the second test is also finished. Now, ma'am, please have it. Now we are going to check these two nerves together. Third is oculomotor, the fourth is trochlear. Because the both functions are eye movement, the first test is extraocular muscle test. For that, ask the patient to stand up. Ma'am, please. Keep the distance of one arm. Now, ask the patient to focus in your fingertip. In head pattern, we have to move the hand. So the first test is finished. Second test, pupil reaction test. It is applicable for both oculomotor nerve and optic nerve. In that, we are going to check PARLA. PARLA stands for P pupil, E equal, R round, another R for reactive, L for light reflex, A for accommodation. First, pupil. We have to check pen torch. Now, ask the patient to see the distant object. Ma'am, please see the distant object. From side, flash the light in front of the eye, then to the second eye. I am checking the accommodation. Ask the patient to focus an object. Check for the pupil dilation and constriction. Ask the patient to see the tip, the nearest object, then take the object further. The next test is for trochlear nerve. The test name is downward and inward gaze test. First, assist the patient to stand. Ma'am, please stand up. Keep the distance of one arm. Ask the patient to focus in your fingertip. Now, move the hand upward and downward. This is the test for checking trochlear nerve. Ma'am, please have it. So now we are going to check the trigeminal nerve activity. There are two tests. First, I am going to demonstrate about light touch test. For that, we need cotton ball or the gauze piece. First, ask the patient to sit. Then, please ask the patient to close their eyes. Ma'am, please close your eyes. There are three areas we have to touch. First is forehead, then cheek, and then jaw. Then ask the patient to say touch whenever they feel touch. Touch, touch, touch. Good. So now she is able to detect the touch. As she is able to detect the touch, her facial sensation is good. The next test is for assessing the chewing. The test name is called jaw clenching test. Ask the patient to clench their teeth. Ma'am, please. In this, we're gonna palpate the masseter and temporalis muscle. We have to check the firmness and symmetry. Additionally, ask the patient to open their mouth, give the resistance, and ask the patient to move their jaw side to side. Ma'am, please. Good. As Miss Sidra is able to clench her teeth and the muscles are firm and she is able to move her jaw side to side, her trigeminal nerve is functioning normally. The next nerve is abducens nerve. To assist this nerve, we have one test that is called lateral gaze test. In that, ask the patient to stand. Ma'am, please stand. Keep the distance of one arm. Now, ask the patient to focus on your fingertip and move your hand side to side, laterally. Good. Through this test, we can confirm her abducens nerve is functioning correctly. The next nerve is facial nerve. To assist this nerve, we have two tests. First is facial symmetry test. For this, ma'am, blink your eyes, raise the eyebrows, smile for me, frown, puff the cheeks. So, Miss Sidra is able to do in a symmetric way. We can confirm that her facial nerve is functioning normally. The second test to assess the facial nerve is taste test. In this, ask the patient to close their eyes. Ma'am, please close your eyes. Now, take the material which have been taken for taste. Now, ask the patient to open their mouth. Ask the patient to detect the taste. Ma'am, can you please tell me the taste? It is sugar. Good. So, she is able to detect the taste. Her facial nerve is functioning normal. The next nerve is vestibulocochlear nerve. To assist this nerve, first test is whisper test. In this test, ask the patient to stand. Ma'am, please stand up. Then cover the one ear. Take one arm distance. Ask the patient to listen. Then again for the next ear, same. We have to cover the ear. One arm distance. Again whisper. As well as Siddharth is able to say, the first test is passed. Otherwise, we can also test, ask the patient to turn back, keep a distance of one arm, ask the patient to cover one ear, then you speak. Same for the next ear. Like this, we can also test. Through this assessment, we can understand the vestibulocochlear nerve is functioning normal. Miss Siddharth, now I am going to check your hearing ability. At first, I am going to strike the tuning fork. Then I will keep over your mastoid process. First, you will hear the sound, but over a time, you are not able to hear. At that time, you say me. Okay? Then I will immediately keep in front of your ear canal. Then you say if you are able to hear or not. Okay? Are you able to hear? Yes, yes, yes. Now? No. Now? Yes, yes. Okay. So in this test, first we are going to strike the tuning fork. Then we have to keep over the mastoid process. First, the patient is able to hear. Then you have to keep taking it away until the patient is unable to hear. Then immediately we have to keep in front of the ear canal, keeping the distance of 1 centimeter. Then patient will say if they are able to hear or not. As the Miss Siddharth is able to hear, her vestibulocochlear nerve is functioning normal. Ma'am, now the second test to test your hearing ability. First I will strike the tuning fork, then I will keep in middle of your forehead. Then you have to tell me if you are able to hear from both eyes. Okay? Are you able to hear? So we have to check the Weber test. First we have to strike the tuning fork. Then we have to keep midline of the forehead. Then ask the patient if they are able to hear from both ears. As the Miss Siddharth is able to hear, her vestibulocochlear nerve is functioning normal. The next nerve is glossopharyngeal nerve. The first test is called gag reflex. Ma'am, now I am going to check your function of glossopharyngeal nerve. In that I am going to put the tongue depressor in your posterior pharyngeal wall. You will have the gag. Don't worry, this is a normal reflex. Okay. For if you feel like vomiting, you just vomit. Please open your mouth. So the test, we have to take first ask the patient to sit, then explain the procedure, then ask the patient to open their mouth, take a tongue depressor, touch the posterior pharyngeal wall, then they will get gag. If they gag, the glossopharyngeal nerve is working normal. As Mr. Siddharth is able to gag, her glossopharyngeal nerve functioning normal. Nerve is vagus nerve. The first test is voice quality test. In that we have to observe the patient's voice or talking. How are you, ma'am? I'm testing you from a long time. I'm feeling good, ma'am. Are you tired? No, ma'am. So, in this test, the voice quality test, we are observing if the patient is talking from vocal tone or the nasal tone. If there is any hoarseness, it indicates the paralysis of vocal cord. The next test to assess the vagus nerve is uvula movement. In that, we have to use the pen torch, then ask the patient to open their mouth, elevate, then say ah. So the midline elevation of uvula is present. It confirms her vagus nerve is functioning normal. So the next nerve is accessory nerve. The first test for assessing the accessory nerve is shoulder shrug test. First give the resistance, downward resistance. Ask the patient to shrug their shoulder. Then check for the firmness of trapezius muscle and symmetry of the muscles. As the shoulder symmetry is correct and firmness is present, her accessory nerve is functioning normally. The next test to assess the accessory nerve is head turn test. First, give the resistance in the neck A region. Ask the patient to turn to opposite side. In this, we have to check the firmness of sternocleidomastoid muscle. Then same to the next other side. So we have to assess the symmetry. As the firmness is present and the symmetry is equal, her accessory nerve is functioning normally. The next nerve is the last nerve, that is hypoglossal nerve. To assess that nerve, we have a test called tongue mobility test. Ask the patient to open their mouth, stick out their tongue, then ask the patient to move the tongue side to side. We have to check the asymmetry or weakness of the tongue. If there is no asymmetry observation is there, we can confirm her hypoglossal nerve is functioning normal. So this is all about the examination of 12 cranial nerves. Thank you. Thank you, Sidra, for assisting me and helping me. Thank you, sister. Thank you, everyone.